Welcome to today's video lecture. Today, we're going to delve into a fascinating topic, cholelithiasis. Before we start, don't forget to check out our website madeformedical.com for hundreds of more videos like this at the end of this video. The link is in the description. Welcome to today's video lecture on cholelithiasis. In this session, we will delve into the intricacies of this complex disease, including its etiology, pathophysiology, clinical presentation, diagnostic approaches, and management strategies. By the end of this lecture, you will have a comprehensive understanding of cholelithiasis and its impact on patient care. So, let's begin. Cholelithiasis is a common condition characterized by the formation of gallstones. Gallstones are solid deposits that develop within the gallbladder or bile ducts. They are primarily composed of cholesterol, bile pigments, and calcium salts. There are two main types of gallstones: cholesterol stones and pigment stones. Cholesterol stones are the most prevalent type and form when there is an imbalance in the composition of bile. Normally, bile contains cholesterol, bile salts, bilirubin, and other substances. When there is an excessive amount of cholesterol or a decrease in bile salts, the cholesterol can precipitate and form stones. These stones can vary in size and may be single or multiple. Pigment stones, on the other hand, are composed of bilirubin, a waste product formed during the breakdown of red blood cells. They are more commonly seen in individuals with conditions such as cirrhosis or hemolytic disorders. Pigment stones can be further classified into black or brown stones based on their color. So cholelithiasis, or the formation of gallstones, occurs as a result of an imbalance in the composition of bile within the gallbladder. Bile is a digestive fluid produced by the liver that helps in the digestion and absorption of fats. The pathophysiology of cholelithiasis involves the precipitation and accumulation of substances within the gallbladder, leading to the formation of gallstones. There are two main types of gallstones: cholesterol stones and pigment stones. Cholesterol stones. Cholesterol stones are the most common type and are composed mainly of cholesterol. The formation of cholesterol stones is influenced by several factors, including excess cholesterol. Elevated levels of cholesterol in bile can contribute to the formation of cholesterol stones. This can occur due to increased cholesterol secretion by the liver or reduced secretion of bile salts, which help to keep cholesterol in solution. Decreased bile salt levels. Bile salts play a crucial role in solubilizing cholesterol in bile. When there is a decrease in bile salt levels, cholesterol can precipitate and form stones. Gallbladder motility. Reduced gallbladder contraction and impaired emptying can lead to stasis of bile, increasing the likelihood of stone formation. Pigment stones. Pigment stones are less common and are composed of bilirubin, a breakdown product of hemoglobin. The formation of pigment stones is associated with conditions that increase the breakdown of red blood cells or impair bilirubin metabolism, such as hemolytic disorders. Conditions that result in increased destruction of red blood cells, such as sickle cell disease or hereditary spherocytosis, can lead to the formation of pigment stones. Liver disease. Liver diseases that affect bilirubin metabolism, such as cirrhosis or certain infections, can contribute to the development of pigment stones. The clinical presentation can vary depending on the presence of symptoms and the occurrence of complications. Here are the key clinical features. Asymptomatic. Many individuals with cholelithiasis remain asymptomatic, and the condition is incidentally detected during imaging studies performed for unrelated reasons. Biliary colic. This is the most common symptom associated with cholelithiasis. Biliary colic is characterized by sudden and intense pain in the upper abdomen or right upper quadrant. The pain is often episodic and typically lasts for a few hours. It can radiate to the back or right shoulder. Biliary colic is frequently triggered by the ingestion of fatty or greasy foods. Nausea and vomiting. Biliary colic may be accompanied by nausea and vomiting, especially if the pain is severe. Jaundice. Obstruction of the common bile duct by a gallstone can lead to jaundice. This is characterized by yellowing of the skin and sclera, icterus, dark urine, bilirubinuria, and pale-colored stools, acholic stools, due to reduced bilirubin expression into the intestines. Fever and chills. In some cases, cholelithiasis can lead to complications such as acute cholecystitis, inflammation of the gallbladder, or ascending cholangitis, infection of the bile ducts. These complications can manifest with symptoms of fever, chills, and signs of systemic inflammation. The diagnosis of cholelithiasis involves a combination of clinical evaluation, imaging studies, and laboratory tests. Here are the key aspects of diagnosing cholelithiasis: clinical medical history and physical examination. The initial step in diagnosis is obtaining a detailed medical history and performing a thorough physical examination. This helps in identifying symptoms such as biliary colic, jaundice, and risk factors associated with cholelithiasis. Laboratory testing. Laboratory tests are important to support the diagnosis of cholelithiasis. These include liver function tests. LFT can help assess liver function and identify any liver or bile duct abnormalities. Elevations in liver enzymes, for example. Alanine transaminase, a LT, aspartate transaminase, a ST, alkaline phosphatase, and bilirubin levels may suggest the presence of gallstones or associated complications. Complete blood count. CBC may reveal elevated white blood cell count, suggesting an inflammatory response or infection. Amylase and lipase. These tests may be performed to rule out pancreatitis, as gallstone obstruction can lead to pancreatic inflammation. Imaging studies. Ultrasound. Abdominal ultrasound is the primary imaging modality for diagnosing cholelithiasis. It can detect the presence of gallstones, assess gallbladder wall thickness, and evaluate for complications such as gallbladder inflammation or dilated bile ducts. Computed tomography scan. A CT scan may be performed in cases where additional information is needed or when complications such as cholelithiasis or pancreatitis are suspected. Magnetic resonance cholangiopancreatography, MRCP. MRCP is a non-invasive imaging technique that can provide detailed visualization of the biliary system, allowing identification of gallstones and any associated bile duct abnormalities. Endoscopic retrograde cholangiopancreatography, ERCP. ERCP is an invasive procedure that combines endoscopy and fluoroscopy to visualize the biliary system. It is primarily used to diagnose and treat bile duct stones and associated conditions. The treatment of cholelithiasis depends on various factors such as the presence of symptoms, the size and number of gallstones, and the risk of complications. Here are the key treatment approaches for cholelithiasis. Observation. Asymptomatic gallstones. In individuals without symptoms, asymptomatic gallstones, a conservative approach of observation without active intervention is often recommended. Regular monitoring and follow-up imaging studies may be performed to assess any changes in gallstone size or the development of symptoms. Symptomatic management. For patients experiencing biliary colic, like intermittent and severe pain, management focuses on providing symptomatic relief during episodes of pain. This typically involves the administration of analgesics, such as nonsteroidal anti-inflammatory drugs, NSAIDs, or opioids as needed. Surgical intervention. The most definitive treatment for cholelithiasis is surgical removal of the gallbladder, known as cholecystectomy. This approach is often recommended for patients with symptomatic gallstones or those at higher risk of complications. It can either be open or laparoscopic cholecystectomy. Laparoscopic cholecystectomy is a minimally invasive procedure that involves the removal of the gallbladder using small incisions and specialized instruments called laparoscopy. It is the most minimally invasive procedure, as can be seen in the picture of a patient who had a laparoscopic cholecystectomy. Open cholecystectomy. In certain situations, such as when laparoscopic cholecystectomy is not feasible, an open surgical approach may be necessary. Medications. Ursodoxycholic acid, UDC, is a medication that can be prescribed to dissolve cholesterol gallstones in selected patients. It may be considered for patients who are unable or unwilling to undergo surgery or those with small cholesterol gallstones and preserved gallbladder function. Endoscopic procedures. Endoscopic retrograde cholangiopancreatography, ERCP. ERCP can be used to remove gallstones from the common bile duct or to place a stent to relieve the biliary obstruction. This procedure is often performed in conjunction with other interventions or in cases where gallstones have migrated from the gallbladder to the bile ducts. The choice of treatment approach depends on factors such as the patient's clinical condition, the severity of symptoms, the presence of complications, and individual patient preferences. Treatment decisions are made on a case-by-case basis, and it is important to discuss the available options and their associated risks and benefits with the patient. In conclusion, cholelithiasis is a common condition characterized by the presence of gallstones. It can present with a range of symptoms, from asymptomatic to biliary colic and complications. Prompt diagnosis, appropriate management strategies, and preventive measures are essential in providing optimal care to patients with cholelithiasis. And that brings us to the end of our today's video. I hope you found the information helpful and informative. If you enjoyed this video, don't forget to give it a thumbs up, and don't forget to sign up for a premium membership on our website, madeformedical.com, for more content like this.